16. Explain prion disease, its characteristics, and the various forms it takes in humans and animals. Prion diseases, or transmissible spongiform encephalopathies, TSES, are progressive neurodegenerative disorders characterized by long incubation periods, spongiform changes with neuronal loss, and rapid progression. They present in humans through diseases like Creutzfeldt, Jakob disease, CHD, variant Creutzfeldt, Jakob disease, Jakob disease, Straussler-Schenker syndrome, fatal familial insomnia, and Kuru. In animals, they manifest as bovine spongiform encephalopathy, BC, chronic wasting disease, CUD, scrapie, transmissible mink encephalopathy, feline spongiform encephalopathy, and ungulate spongiform encephalopathy. 17. Explain the nature of epidural and subdural infections and their potential consequences. Epidural and subdural infections can occur due to bacterial or fungal infections in these spaces, usually arising from local spread. An extradural epidural abscess, localized with limited lateral spread, can result in mechanical compression, ischemia, and infarctions. On the other hand, a subdural empyema, originating from infections spreading from the skull bones or paranasal sinuses, may lead to mass effects and venous occlusion. 18. Discuss the characteristics of acute pyogenic meningitis and its potential complications. Acute pyogenic meningitis is caused by pyogenic bacteria, resulting in the accumulation of creamy opaque exudate in the subarachnoid space, dull opaque meninges, and prominent congested blood vessels. Complications may include the infiltration of organisms into the brain, cerebral abscess, ventriculitis, thrombosis of veins, fatal outcomes, leptomeningeal fibrosis, blockage of ceph flow leading to hydrocephalus, petechia dick, and meningococcal septicemia. 19. Define viral meningitis and its characteristics compared to bacterial meningitis. Viral meningitis is usually a milder form of the disease compared to bacterial meningitis. It is generally self-limiting and may present with less severe symptoms. 20. Explain the nature of cerebral abscess, including its spread, histological appearance, and clinical symptoms. A cerebral abscess is a focal area of suppuration in the brain, commonly due to mixed bacterial infections. It can spread through direct implantation, local extension from adjacent foci, or hematogenous spread. Histologically, it exhibits central liquefactive necrosis surrounded by granulation tissue, collagen, and gliosis. Clinical symptoms often include fever, space, occupying lesion features, seizures, and focal neurological signs. 21. Elaborate on the complications associated with cerebral abscess. Complications of cerebral abscess may involve increased intracranial pressure leading to herniation, rupture resulting in ventriculitis, meningitis, and veningitis, and venous sinus thrombosis. 22. Discuss the manifestations and complications of tuberculosis affecting the cans. Tuberculosis of the cans can appear as tuberculous meningitis and tuberculoma. Complications may include ceph flow obstruction, cranial nerve palsies, brain infarctions, and focal neurological signs. 23. Describe the clinical symptoms and forms of neurosyphilis. Neurosyphilis can present as meningovascular neurosyphilis with chronic meningitis, general paresis involving cerebral atrophy tabes dorsalis with spinal cord demyelination, and gamma formation. 24. Explain the different types of encephalitis and their associated clinical symptoms. Encephalitis comprises various types, including poliomyelitis, rabies, and subacute sclerosing panencephalitis, SPE, causing progressive neuronal damage and manifesting with symptoms of diffuse brain involvement. 25. Describe the impact of hive on the brain, detailing direct and indirect effects. The effects of hive on the brain include progressive dementia due to hive meningoencephalitis, AIDS, associated myopathy, peripheral neuropathy, and opportunistic infections like mycobacterial infections, toxoplasmosis, and Sheen's lymphoma. 26. Explain prion disease, its characteristics, and its occurrence in humans and animals. Prion diseases such as Creutzfeldt, Jakob disease, CHD, variant Creutzfeldt, Jacob disease, Wicksteed, Gershman-Straussler, Schenker syndrome, fatal familial insomnia, Kourou, bovine spongiform encephalopathy, Beezy, chronic wasting disease, Hood, Scrappy, and others are neurodegenerative disorders causing spongiform changes, rapid progression, and characteristic amyloid, like plaque formation. 27. Define the nature of epidural and subdural infections and their possible implications. Epidural and subdural infections occur due to bacterial or fungal invasion, leading to localized infections and spread. Complications may include mechanical compression, ischemia, and infarctions, along with potential mass effects and venous occlusion. 28. What are the complications of tuberculous meningitis? The complications of tuberculous meningitis may involve adhesion-related CF flow obstruction, cranial nerve entrapment, and arthritis causing brain infarctions and cranial nerve palsies. 29. Describe the potential forms and complications of neurosyphilis. Neurosyphilis may manifest as meningovascular neurosyphilis, general paresis, tabes dorsalis, and gumma formation. Complications can include meningeal symptoms, cerebral atrophy, spinal cord demyelination, and various neurological impairment. 30. Elucidate the impact of hive on the brain and its associated effects. The impact of hive on the brain involves progressive dementia due to hive meningoencephalitis, associated myopathy, neuropathy, and opportunistic infections such as mycobacterial infections, toxoplasmosis, and